name is Sara. I've worked in healthcare for almost 20 years. I started off as an EMT and I'm a medical assistant now. And for me, health insurance is just something that I can't afford. Currently, I do work 7 days a week. That is being impacted by the coronavirus. My part-time job doesn't have me coming in for that due to the lack of necessity for more employees at the moment. So I don't have all the income that I normally have. But even when I do, I can't afford health insurance. Health insurance is something that I don't have, but I could really use because I have chronic conditions like asthma and chronic migraine. I know that I have had more migraines just recently. I'm not really sure, what exactly that is since I can't really follow with a neurologist, but I know over the past week, I've had more migraines during the last week than I've had in a really long time. So it may be, stress induced because I am losing income. I'm losing a partial income. That's a Saturday and Sunday job for me. And that's something that may be having an effect on my migraines for sure. For me, not being able to apply for Medicaid or Medicare and be approved for that because I work so much, because I'm outside of what they consider a poverty level. But if I don't work so much, I also then can't pay my own bills. So that's something, there's no middle ground to this. There is either you make so much money, you can afford healthcare and everything's really great, or you make so little that you're in poverty level and the state will financially help you with insurance. For me, I'm right in that middle where I make too much for any help, but I don't make enough to actually be able to afford it. So for me, there's no middle ground. I looked at the marketplace. The marketplace had a really high deductible. And then also the monthly payment was really high and something I wouldn't be able to put out there with what I have now. So that's not even an option. For me, having a migraine, if I take all my medicines at home and then I have to go to the ER, that could really devastate me financially because I don't have insurance and I also don't have the money to be able to save to afford something like that, to go to the ER and be able to pay those doctor bills and come out okay from that. So there's nothing that for someone like myself, there's nothing that where you can work, you can be a hardworking citizen, you can pay for your, monthly bills on time, but insurance is the problem for me. Expansion is important for persons like myself. Again, I work for doctors. Just talking around my office, I'm not the only one, unfortunately. Everyone's around the same pay scale. And of course, we don't really get into too many details. But the point is, none of us have health insurance. It's really good if this expansion was able to happen because you have hardworking people who have gone to college, who have degrees, who are in jobs that require special training, like the job that I'm in, but still can't have health insurance because while I'm not making, minimum wage, I'm still not making enough. And I think that that's important that we get that gap filled where, look, we see that you're putting this in, you have a college degree, this is a skilled trade, you are doing something that you could not do without having gone to school or without additional resources or training. But here's the one thing you're lacking, and here's how we can help you with that. That's important because I'm not the only one. And it's important that we get everybody a chance at healthcare.